Hi, everybody, and thanks for joining us. It's a cold January day, but January is Thyroid Awareness Month. So I'm Grace Meehan. I'm a clinical pharmacist and certified menopause practitioner with the North American Menopause Society. And I'm thrilled to be joined by my colleague, Dr. Sarah Brill-Morgan, who's an awesome naturopath with NutriChem Pharmacy. And, usually I'd see Sarah in person, but with the pandemic, we're screens. So another screen
Yeah,
meeting today, Sarah, but
exactly. Yeah, at least we can do this though. So that's nice. And we can be unmasked.
exactly. Yeah. If we were going to be in the same room, we were going to do this with masks.
Yeah,
It might have been a little prohibitive for people to hear us properly. Um, anyway, we're going to talk thyroid, all things thyroid, and hopefully we'll answer some questions that people, in their heads have and sort of calm some of those questions down. So let's start with the basics. Sarah, like what's the thyroid gland and why
yeah.
is it so important?
Yeah, so I have this conversation with patients all the time and kind of just explaining it because I feel like a lot of people don't really know what the thyroid is, where it is, what it really does. They have an idea that, I might have a thyroid issue, but when I ask them kind of about the thyroid, they don't really know a lot. So I feel like it's always good for them to know your thyroid's located in your neck. It's a butterfly-shaped gland, and it does a lot of different things. But the big thing that we look at kind of in thyroid health, thyroid conditions is really kind of the hormones that it creates, right? And what those do for us. So I always kind of go through it with patients in terms of, the different testing that we do, but also what it does. So we have something called TSH, thyroid stimulating hormone, that comes from our brain, from our pituitary gland. And it actually is kind of like the gas pedal, or how much, signal the brain needs to give the thyroid in order for the thyroid to make hormone. So I always use it kind of as the gas pedal, like how much gas does your brain need to give your thyroid in order for your thyroid to, move or create hormone. So that's one thing that that's a signaling hormone. And then your thyroid actually makes a few different hormones, but mainly we're looking at T4 and T3.
Mm-hmm.
And T4 is mainly made by your thyroid. And then T4 actually has to be converted into T3, mainly in the liver. And so T3 is our actual active hormone, which means that's actually what's going to go out and bind to our thyroid receptors in our body and, do the most action. So really, when we're looking at thyroid health, those are the ones that we really want to look at too.
Exactly. So if I'm told that I've got low thyroid, what are some symptoms that I might be experiencing? And because we know the thyroid affects so many systems, there's a lot of stuff that can be happening, right?
Exactly. And I mean, I think that's sometimes why things get misdiagnosed or people, go so long, because it does show up in different ways for different people. But the main things that we see really when we have, a low functioning thyroid or a hypothyroid is really like a lot of fatigue. That's kind of the biggest one, low energy. We can have issues with, hair falling out, our skin being really, really dry. A lot of people will have issues with like sleep or digestion. And a big one is weight loss.
Absolutely.
Having major issues with losing weight, or just like feeling like you're gaining weight and you haven't really changed anything. Your diet hasn't changed, your exercise routine hasn't changed, but you're like, this doesn't make sense.
Yeah, really frustrating.
Yeah.
Because I see women sort of menopause and just before menopause, I see a lot of women with menstrual irregularities, maybe heavy flow or light flow or no flow at all through their menstrual cycles, and hot flashes too. So they think it's a menopause symptom, but often the thyroid needs to be looked at. And they're always surprised when that's part of it, because they just think it's, oh, here I am going into menopause.
Yeah, exactly. And I think that I see that all the time as well, right? And even in younger women where, they're just having like really irregular periods, things don't really make sense. We look at hormones and hormones all look good. And so then we look at thyroid and say, oh yeah, do you know what? It's actually like that more thyroid based than anything.
Right. And they're so relieved at least to find out what's going on, right? Because if it's just told everything's fine, darn, like what's going on? Yeah.
Yeah, it's so, and I mean, that's like the majority of patients that I see is really like that frustration of saying like, I know something's wrong. I can feel it in my body. I know there's something off, but I'm going and doing all this testing and everyone's telling me that I'm well and I don't feel well, and what is actually happening, right? Yeah.
Absolutely. Constipation is another one too. I don't know if you mentioned that one, but constipation is a sign that there could be something off there too, right?
Yeah, exactly. And I think sometimes we get so caught up in like what the specific symptoms are that people are like, well, that's not me. Like, sometimes I feel like people will come in and they have like really loose stools, and then that will clear up when we start to treat the thyroid as well. So usually that's seen as more of a hyperthyroid or a overactive thyroid, but I do see it as well. So I usually just say like digestive complaints in terms of
Right.
constipation or diarrhea or a mixed IBS. Like it can be a bunch of different things all together.
Right, absolutely. So like how prevalent would you say thyroid issues are?
God. I think they're very prevalent.
Yeah.
I don't know if they're becoming more prevalent or if they're just more, knowledge and that sort of thing about it. But I do feel like, a lot of people I see have some kind of thyroid dysfunction.
Mm-hmm.
And I do, the prevalence, I don't know what the percentage would be, but it's up there for sure.
Yeah, I know as women go through menopause, like into their 40s or so, thyroid testing is absolutely a must because there's a lot of women who are going to experience it. And certainly there's men as well who have it.
Yeah, exactly.
Yeah. So in terms of diagnosis, what's the typical test that a patient will get offered when they're thinking about thyroid?
Yeah, exactly. So I kind of mentioned it before, but looking at TSH, which is our thyroid stimulating hormone, that's the main one that your medical doctor will run for you. Whether it's
the only one that will get run.
The only
right?
one.
Yeah.
Yeah, exactly. So that's the only one that we like that conventional medicine tends to look at. And I always tell patients like that's kind of not even half of the picture of what's going on. It can tell us if there's something, drastically wrong in terms of your TSH being way too high or super, super low, but it doesn't actually tell us what the thyroid's actually doing, right? As I said before, it's kind of just a gas pedal. So like how much gas does the brain need to give the thyroid in order for the thyroid to actually make adequate hormone? But a lot of the time, we'll have, like normal within the range of TSH.
Mm-hmm. And what's the range in Canada?
Yeah, so the range is 0.35 to 5.
A broad range, right? That's a broad range.
It's a huge range. It's a massive range. So I know in like Europe and different places, it's actually low as 3. Mm-hmm. Ideally, I like to see TSH, and I know that you do at under 2. Yeah. Is my ideal range.
People tend to feel better when it's down there.
Exactly. So, I mean, a lot of the time people will come in, they're like, well, my TSH was fine. Like my doctor told me my thyroid was fine. And so then we run, we'll look at the hormones. So we'll look at TSH along with T4, free T4 and free T3. Mm-hmm. And we'll see, okay, yeah, like your TSH might be at, 3.5 or 4, which is still high for me. But your T3 is super low. You're not creating anything, and your T4 is on the low end as well, right? And so therefore you are having thyroid symptoms and issues with that.
Exactly. I think I read if you look just at TSH only, but 80% of thyroid patients won't be diagnosed just with TSH alone. So those other tests are vital. What other thyroid tests? Like we dig deep sometimes, right?
Yeah. Exactly.
If everything's coming back looking normal, we don't really just settle for that. We're going to dig a little deeper. What other thyroid tests will we run?
Exactly. So, I mean, my favorite ones, we do a lot of different things, but my favorite ones are definitely to take a look at something called reverse T3.
Yes.
Right. And reverse T3 is actually really cool because T4 can actually be converted into T3, or it can be converted into reverse T3. And a lot of the time, if there's a lot of inflammation, there's different viral infections that are happening, chronic things that are going on, then our body will actually
pain. It can be your fibromyalgia patients.
Exactly. Chronic pain.
Lyme patients, right? So when diabetes, type 2 diabetics, have a reverse T3 issue too.
Yeah, exactly. And so instead of our bodies actually converting into T3, which is our active hormone, which makes us feel good and, deals with all those symptoms, we make reverse T3 instead. And that's an inactive form of T3. So we don't actually do anything with that, and that can cause issues. So your thyroid panel can look totally fine, but if your reverse T3 is high, then we know we're not actually getting enough T3.
Right. Yeah, exactly. Reverse T3 can be high, and regular free T3 can look good.
Yeah, exactly.
But then lo and behold, that reverse T3 comes back high. And you go, oh, eureka, there it is. right?
Yeah, exactly. And then the other ones that I really like to look at, usually in most thyroid patients, are looking at antibodies.
Yes.
So our thyroid antibodies, so anti-TPO and anti-thyroglobulin. And those are really important to say, okay, is this an autoimmune condition of the thyroid?
Explain,
You
what's
know,
an autoimmune condition of the thyroid?
yeah, so we call it well, I mean, in terms of hypothyroid, which is what we tend to deal with a little bit more, it's an autoimmune. So your body, your immune system actually attacking your thyroid and creating a thyroid condition.
Yes.
So we tend to have auto antibodies or antibodies that are attacking our thyroid, and we can actually measure those in our blood.
Right. And it's true that you can have a beautifully looking thyroid panel.
Yeah.
Everything's good. And then you look at antibodies and that's the issue, right? So we can't just stop at the regular thyroid panel. Doing that extra dig is going to,
Yeah, exactly. And I mean, there's lots of research looking at, even elevated thyroid antibodies when you don't have thyroid symptoms actually correlating to thyroid symptoms in the future as well. So I think it's a really great preventative way of saying, okay, this is something that we want to work on now so that you don't necessarily have thyroid issues, moving forward.
Right. So some other things that we like to look at, nutrients. Can you talk about the role of nutrients with thyroid?
Yeah, so I mean, there's a lot of different nutrients that we need for that thyroid conversion, from T4 to T3, but also just thyroid health in general. So the big ones that we tend to look at are, iodine, selenium, zinc, even vitamin D. There's a lot of other ones as well, but those are kind of the big ones. And making sure that those levels are all iron is another big one.
Iron, yes, yeah.
So making sure that all of those levels are actually, adequate so that we are actually having that conversion and we're actually able to make thyroid hormone in the first place.
Absolutely. Those are key. I found the vitamin D link really interesting because so many people in Canada are D deficient.
Yeah.
We get no sun here. We've got long winter months. And patients are often told by regular practitioners, take 1,000 units of vitamin D a day just for, regular health.
If that, yeah.
If that at all. But
Yeah.
we always measure vitamin D for the reasons that who knows what your level's like, right? So how do you know how much to take?
Yeah, exactly. And I think this year, for some reason, I don't know if it was lockdown and people are not outside as much, but I've seen the lowest vitamin D levels I've ever seen in practice. So I think that's a huge thing. And I mean, there's definitely correlation with a lot of different things. They're finding more, inflammatory markers with vitamin D and how that actually regulates it. So yeah, vitamin D, if you haven't got levels tested or you're not taking it, on vitamin D. You need to have it. It's one of those things that we don't have sun, so we need vitamin D, especially in Canada.
We've got so many roles in the body for so many important things.
So many things.
Yeah.
So many things.
Yeah. Now you touched on the gut a little bit, but NutriChem, we're all about the gut.
Yeah.
Why such a focus on the gut? How does that affect, inflammation, body, etc.?
Yeah, I mean, so the gut is always kind of usually the key to everything in a lot of different ways, right? In our microbiome and our flora and everything in there regulates so many different hormones, so many different processes. And as we talked about kind of before with thyroid, a lot of the time there is a lot of gut issues. So there, not always, but there's IBS, there's constipation a lot of the time, but there is sometimes loose stools or things like that. And so, the gut really does regulate a lot of our inflammatory response, a lot of our immune response. So when we're looking at autoimmune conditions with the thyroid, Hashimoto's, that sort of thing, it is a lot gut related. So I tend to do a lot of gut work with thyroid patients as well to kind of get more to the root, right?
Once their gut becomes healthier, so many things improve, right? Their energy improves, their brain function improves, their sleep improves, it's on and on and on, and their thyroid can improve as well. Yeah. So it's the key to everything. We also look at diet, and oftentimes we recommend certain diets for patients who have gut issues, right? So for example, gluten. Can you speak to gluten and thyroid?
Yeah, so I think that's probably the number one. And I know I hate it with patients because I feel it's really trendy and they're oh, but with Hashimoto's, with autoimmune thyroid conditions, that's for me almost number one in terms of removing gluten, because it has such an inflammatory response, and it does actually mimic even the antibody shape and that sort of thing. So with that, right? So like it's huge with that. And I do find even just removing gluten with thyroid conditions, it significantly changes levels. You see a massive improvement. So
Right,
yeah.
right. Now, on the same topic of diet, I often get questions about cruciferous vegetables. So your broccoli, your cauliflower, your kale, and Brussels sprouts, and is that going to be a problem for thyroid? What do you think?
Mhm. Yeah, and I think people really stress about that. And I don't know if there is,
Mhm.
that much stress needed to be around it. I think, like, as we were talking about, like, if you're doing like, a massive amount of broccoli a day, or like a kale smoothie every morning with like a ton of different of those veg in it, yeah, maybe not like the best. But when we're looking at studies, honestly, it's like a few pounds a day, which is a lot of broccoli, a lot of those veggies. So ultimately, I'm like, we don't really want to worry about it. And I don't want to scare people off from, really good eating, really clean eating, having lots of, lovely greens and things in their diet. So yeah, for me, it's not something that I really worry about too much. And I do know that it's like a major cause of stress for a lot of people, though.
It is, and I
Yeah,
think if people are really worried about it, cook some of it sometimes. I think it's the
exactly.
huge amounts of raw that are going to be more of
Yeah,
the problem. Correct? Yeah.
exactly. Yeah.
Um, so, in concluding, basically, can you speak to any case that you've had of somebody who has come in that you've helped with a thyroid issue?
Yeah. Yeah. So, I mean, I think that's like probably the majority of my practice in terms of thyroid issues. I could go on for hours, but yeah, I mean, I think the normal patient that comes in terms of thyroid issues is a lot of the time they are kind of like pre-menopause at that kind of age, right? Things kind of go a little bit more wacky at that point in time. And, they're really tired. They're just like kind of burnt out in that state. They are gaining weight. And I think that's probably the biggest thing that people come in for is like, I don't understand. I'm doing everything the same. Like nothing has really changed, or little things have changed, but there's nothing like crazy. And I just keep gaining weight and I don't understand what's going on. And they're constipated and they're having menstrual irregularities as well, which they're saying, yeah, exactly, it's perimenopause, or is there something going on there?
And oftentimes, if I can interrupt for a second, they're being offered antidepressants, right? That's
Yes.
what I see so often.
Yes.
It's not an antidepressant deficiency. There's something else going on, right?
Yeah, exactly. It's never an antidepressant deficiency. Yeah. So, I mean, with that as well, I think something that's really important too is a lot of people will come in with those same symptoms being on synthroid and being on synthroid for 20 years or 10 years or 5 years, like a long time, right?
Mhm.
And a lot of them I'll say, like, was there a change when you started synthroid? Did you notice anything? And some
Right.
people will say, nope, nothing. Or other people will say, yeah, I noticed something little, it wasn't like significant, but I still have, X, Y, and Z. And so when we actually look at and do the blood work and take a look at the thyroid function, we're saying, oh, yeah, well, no wonder you feel like crap, and no wonder you're feeling this way. And so we're able to actually address that, whether it's through desiccated thyroid or different minerals and dietary changes.
Right. What's the difference between synthroid and desiccated thyroid for our
Good
viewers?
question. Yeah, I mean, I feel like this is a good question for each.
Well, I know the answer,
Yeah.
but you go ahead.
Yeah, so synthroid is a synthetic T4. So as we talked about the thyroid hormones, T4 is a really great, or sorry, T4 is the thyroid hormone that gets converted into T3, and synthroid is their synthetic form of that T4. So it's made in the lab. The issue with synthroid for some people, not everyone,
Right.
is that a lot of people have a conversion issue. So they have a really hard time converting T4 into T3, right? And so a lot of the time people come in with on synthroid, and they're having the thyroid symptoms. And so what happens is on the lab, we actually see, the T4 looks excellent, right?
Right.
But the T3 is so low, and we're saying, and sometimes reverse T3 is high. So we just see that conversion isn't happening. And so desiccated thyroid is a porcine gland. So it's actually like a pig thyroid that's ground up, which some people kind of find gross, but it's more of a natural form. So we're getting all the different minerals, everything, all the different thyroid hormones in this. And it is more natural in that sense. it doesn't also, like, for some people, you know, they're like, oh, it's more natural, so it's going to work. And it doesn't always work for everyone either. So I feel like that's a good thing to note. But for a lot of people with that conversion issue, desiccated thyroid works so much better because it's actually a mix of T4 and T3.
Right. And you get some T1 and some T2
Exactly.
as well.
Yeah.
And we don't know exactly what they do, but they seem to have some action, right? It's a little more natural. So that could be a good thing too.
Yeah. And even a little tiny bit of minerals in there as well. So
yeah. So I think if for our viewers, we'd say, you know, if you're feeling really not like yourself, if you feel like the weight's going on, the brain fog, all of those things, and you're being told that you're normal, to, you know, look at it a little, get somebody to look at it a little deeper, right, Sarah?
Yeah, exactly. I think that's the biggest thing in terms of, you know, our system right now is you really do have to be an advocate for yourself, right? And really kind of, we ultimately want you to feel empowered about your health. And if you're not feeling that way, then I really, you know, suggest that you dig deeper and do the work, because you can feel good and you deserve to feel good. And if that's not something that you're feeling, then yeah, dig a little bit deeper.
Yeah, it's a long life, right? Going through every day if you're feeling like crap, right? So yeah. So if you've got questions that that you need answers for, let us know. We can answer those questions for you, and happy to do so at NutriChem. That's what we're here for. It's personalized medicine, and it's what we do.
Yeah, awesome. Well, thank you very much, Grace. This was lovely.
It was fun to have you, Sarah. Usually I do these things alone, as do you. So it's nice to have a partner today.
Yeah, it's
really. I just
really
had to ask the questions, and you had to do all the heavy
lifting. We'll switch it up next time.
Okay. Everybody have a good day, and stay thyroid healthy. Thanks.
Sounds good. Happy Thyroid Month.
Bye-bye.